New Hampshire Senator Maggie Hassan joined state public health leaders to discuss racial inequities related to the COVID-19 pandemic. Local 44's Devin Bates has more on what the Granite State is doing to address these disparities.
According to state data, non-white racial and ethnic minorities make up roughly 10% of New Hampshire's population, but over 25% of its COVID cases. Now, 15% of the state's COVID data doesn't include race.
Granite Staters and Americans are trying to focus on how we can change these particular trends and how we can begin to come together and build a more just healthcare system, criminal justice system, housing system, and economy so that we can all thrive.
In May, Governor Chris Sununu formed a COVID-19 equity response team, which is focused on a broader range of issues that contribute to the disproportionate breakdown of COVID-19 cases by race. Melina Hill-Walker, program director for the New Hampshire Endowment for Health, said that understanding how the pandemic impacts minority groups is tied to acknowledging long-standing gaps in education, housing, and health care.
We need to keep in mind that these inequities, highlighted by the COVID-19 pandemic, and as you said, Senator Hassan, are not new. They did not just surface in the nation or in New Hampshire. They have been present all along and require a cross-sector social determinants of health approach to be fully and adequately successful.
Bobby Bagley, director of the Nashua Division of Public Health and Community Services, gave some perspective on how local healthcare workers were able to address these widespread issues within marginalized communities.
We wanted to make sure that we were in the community providing testing in areas where people could have access to that testing, and making sure we also had diverse staff that were available to help provide information in the language, the majority language that was spoken during these testing clinics.
Bagley also mentioned that a lot of the people who tested positive from these marginalized communities were also essential workers, putting them in a tough financial situation because they were unable to work from home. Now, there was a bid to get paid family and medical leave in New Hampshire that was vetoed by Governor Chris Sununu last week. In Burlington, Devin Bates, Local 44 News.